There you go. Thank you. Sorry for the interruption.
So this is a group Medicare Advantage plan. We've built it with bells and whistles. And I'll start by saying my name is Angela Garner. I'm with Brown and Brown. And we've made this plan a passive plan. So if you're seeking treatment from providers today that accept Medicare, you should also you shouldn't have issues going forward. Those same providers are going to be available for use. And I don't want to say in network or out of network because we've actually made this plan a passive plan, which means if providers accept Medicare, they will accept the Medicare Advantage group Blue PPO Plus plan. With that being said, I'm only aware of a couple locations in the country that don't accept this plan. And one, if anyone's heard the Villages in Florida, it's a retirement community. They actually don't even accept Medicare alone. They only accept Humana Medicare Advantage. So you'd have issues there as well. And then in the US also, Mayo Clinic also does not accept Medicare Advantage plans, but in the state of Michigan and nationwide, there are many, many locations. You should not have an issue. If you are having an issue, you can call our office. If anyone wants to write down our office number for claims assistance, if you want to get a pen ready, I will share that number with you now. And we'll also put it in the chat, but it is 866 421 0478. And again, that's 866 421 0478. The other thing is with the bells and whistles that we've added, we've made sure that this plan has the largest drug formulary that Blue Cross Blue Shield offers its members. So you should not have an issue with that either. If for many of the people, the medications, I would say almost every single one, but one medication we were able to find on the list. And that one medication was available in a generic format. But the formulary is pretty wide. If you put your email address in the chat and you want us to send you the formulary so you can search for your medications, you can enter that in the chat as well, and we can send you an email that will have that formulary listing on it. So let me know when you're ready. Otherwise, I'll keep going. Today, we're going to talk about Medicare basics. We're going to get started with how Medicare works. We're going to look at the plan benefits, the drug benefits, and then other programs that are available with Blue Cross Blue Shield. With Medicare basics. So everybody today, if you're on Medicare as a retiree, you have Part A and Part B through Social Security through CMS. So Part A covers your hospital care, skilled nursing facility, hospice, and home health care. Typically, if you have enough work credits, 40 work credits, there is no charge for Part A. And Part B, though, does have a charge. You're enrolled in that, and you pay that through Social Security. Medicare Part A and Part B equals Part C. And so Michael's now available. So I'm going to turn off my sound. Give me a second. I think I've got to hop. Let me do this. Then tell me when.
Good afternoon, everyone. Thanks for attending the meeting. We appreciate your time. Sorry about the technical difficulties that we had. So we'll just continue with the information we're sharing on page 4 if you're following along. As Angela mentioned, you can jot down your questions. More likely, we'll address them as we go through. So continuing with page 4, the left side of the equal sign represents original Medicare, or I refer to it as the red, white, and blue card that you all probably have and use. And so that uh, original Medicare is governed, overseen, and guidance provided by CMS. That's the Center for Medicare and Medicaid Services. That's the part of the federal government that administers original Medicare and provides all of the guidance and rules of engagement for Medicare Advantage plans. So, original Medicare Part A, your red, white, and blue card will show the date that you enrolled in it. You'll note here that it mentions that your premium has already been paid for if you work 10 years full time or the equivalent of 40 quarters. So through the payroll deduction, the cost for Part A of original Medicare has already been paid. Original Medicare Part B is in boy. That includes the coverage for your doctor visits, your labs, durable medical equipment like crutches, wheelchair, prosthetics, and so forth. That is covered and paid for in a monthly premium. You begin paying that when you enroll in Part B, like boy, of original Medicare. It's normally deducted from your Social Security check and is being done so on a monthly basis. So that probably sounds familiar to everyone. That payment that you make for original Medicare is made to the federal government, and it will continue to be come 1/1/25. So the difference you'll notice on the left side of the equal sign is original Medicare. On the right side, you'll note that it says Medicare Advantage, also known as Part C. Now, all of these letters are not unique to Blue Cross. They are, again, universal and given by CMS, the Center for Medicare and Medicaid Services. So, Part C, or Medicare Advantage, gives you all the same rights, privileges, and protections that you have under original Medicare. As noted at the bottom in bold, in blue ink, blue font, you'll note it says you must continue to pay your monthly Part B premium. So you still will have Part B of original Medicare. It hasn't gone anywhere. You can think of it as just a being dormant or having Medicare Advantage or Part C as an umbrella or a blanket. It just kind of overlaps it. So you have all those same rights, benefits, and protections. So, plus, you get additional benefits such as silver sneakers and a few others that you probably don't have today. Now, the Part D, think of that as standing for drugs because it does. That's the prescription drug plan. So, Medicare Part D on the far right space on page 4 is your prescription drug. It's included in your Medicare Advantage plan. So there's no additional enrollment, there's no additional payment. It's all I say it's like ragu. It's in there. It's all rolled into one. So that is your Medicare Advantage plan, which again will take precedent over your original Medicare. You still have original Medicare. So today, under your original Medicare plan, the left side of the equal sign, when you go to the doctor, the hospital, the pharmacy, you provide both your red, white, and blue original Medicare card and your Blue Cross and Blue Shield card. You do that today because both entities are paying a portion of the claims. When it comes to the medical claims, on average, about 80% is being paid. 80% is being paid by Blue Cross Blue Shield. The other percent is being paid by original Medicare. And so, if an explanation of benefits, if you have services provided, the explanation of benefits will be provided by both of those entities. That's the current scenario. Come 1/1/25, the right side of the equation side, your Medicare Advantage plan is fully insured. You don't have to carry or present your original Medicare card. 100% of the claims will be paid by Medicare Advantage and the Blue Cross plan that you're covered under. Therefore, you'll only receive that explanation of benefits from one source, Blue Cross Blue Shield of Michigan. It's also important to note that for Medicare Advantage plans, CMS does not allow you to be enrolled in more than one plan at a time. As a matter of fact, all Medicare Advantage plans are administered on an individual basis. So even if you're married, I'll use myself for example, if I'm married and I have a spouse, that person is covered under their own Medicare Advantage plan. When the cards are issued, and each one of you will receive a new card for your Medicare Advantage plan, you'll receive that prior to 1/1/25. I don't know the exact date, but it'll come out. If by chance it didn't, you should receive a letter that shows what your ID card number is. With that ID card information, you still can obtain services and have them covered. CMS also will not allow you to be enrolled in more than one MA plan at a time. If you enrolled in a second plan, you'll be automatically disenrolled from the first plan that you had. So something good to know. Uh, it's beneficial from being at the meeting. So even if you're through the holidays and some other open enrollment periods, you just stop being inundated with those commercials that come on in between all of the football games that are on. But those commercials that you see on TV are advertising individual Medicare Advantage plans. So while they're similar, it's kind of like having a car. Every brand is different. Every make and model is different. They might have similarities, but they're unique. And so is your Medicare Advantage plans. So with Part D, you have your Part D, your prescription drugs. It's included in your Medicare Advantage. Everything is covered at once. You can only be enrolled under one plan at a time. If you have dependents or a spouse that are covered under your plan currently, but they're not eligible for Medicare Advantage, what happens to them? Great question, and the answer is they will retain the current coverage that they have, both for any dependents and or spouses. If and when they become eligible for the Medicare Advantage plan, then about 90 days prior to that, if it's being eligible by aging in, turning 65, then 90 days before their 65th birthday, they will receive the information from Social Security about registering for Part A of original Medicare. Once that information is obtained for Part A and B, they can provide that red, white, and blue card with those effective dates to the county. The county will work with the process for having the spouse or dependent enrolled into the Medicare Advantage plan. But until such time as they become eligible, they'll stay in the plan that they're in. Also, for all Medicare Advantage plans, in order to be enrolled, you have to have among other things, a permanent address. CMS will not allow the person to be enrolled, which they refer to as accretion. They will not accrete the person or confirm their enrollment in the plan by use of a P.O. box. A physical address is required. Among other things, you also have to, for instance, be a U.S. citizen, be eligible via age and or disability as they prescribe. So next on page 4, that's where we were. Yep, the Medicare Advantage plan. Oh, okay. So on page 6, different documentation that you'll receive. So by virtue of you being in the meeting today, it means you probably received the letter from the county letting you know about the change to the Medicare Advantage. plan, and you also should have received what's referred to as a pre-enrollment kit. So I'm just holding up what is a copy of the benefits at a glance. It's noted on the bottom of page 6, going from left to right. So that benefits at a glance is a more detailed. We're going over the benefits today, but at an aggregate macro level. For more details, you look at the benefits at a glance, and for even additional details, you'll get the evidence of coverage, which will come post enrollment. But for now, that benefits at a glance you should have received in your pre-enrollment kit along with the opt-out form. If you have not received that pre-enrollment kit with the benefits at a glance and the opt-out form, then you need to let us know. You can drop your name and phone number, email into the chat, and we'll reach out to you. I believe, would have had it if they were invited to the meeting. But if you didn't get it, please let us know so we can follow up and make sure everything is working properly. Moving over to the post-enrollment documents, you'll not only receive the welcome letter from Blue Cross, the evidence of coverage, which is your most detailed and itemized description of the plan benefits. You also get a resource guide and a few other things in the way of different benefits that are available to you. Next page. Next page talks about additional enrollment documents. This is primarily set up for online or telephonics enrollment. I think the key takeaway here is that you do not need to take action to be enrolled in the plan. You received on the former page previous, it was noted the opt-out form. The opt-out form only gets filled out and returned to Blue Cross if you're saying no thank you and not taking the Medicare Advantage plan, which is the only plan offered to you by your former employer, County of Midland. So just understand if you say no to it, fill out the form and return it, you will not be automatically enrolled into the plan. You'll still have the original red, white, and blue coverage through original Medicare, but the Medicare Advantage plan is the only additional coverage or the only coverage being offered by County of Midland. Next page, please. The back of the card is on the right-hand side. That gives a number of 800 numbers. You can give a call for provider information, any claims information. You can need to get an ID card, change of address. You can call one of the numbers listed there on the right-hand side or the back of your ID card. Next page, please. So page 9, in addition, you'll get that ID card. You'll also get a welcome call from Blue Cross post-enrollment just to welcome you to the plan, answer any questions that you might have, the health assessment. This is a optional document, but is highly encouraged. With that, you'll be able to gain information to any benefits that maybe you're not currently enrolled in, but could help you. I use the example of the tobacco cessation program. So if I'm a smoker and I like help with stopping, then that tobacco cessation program is offered free, totally confidential, and you don't have to sign up. So you just reach out for that information, so it's free to you. That's where a case where that self-help assessment could work in your favor. Also, the coordination of benefits survey. This is something else sent out by CMS, and they require it to be filled out so that you don't incur any penalties or non-payment of claims. The wording for that might not be as clear and simple as we would like. If you receive documents such as this or other documents that are asking you to provide information, if there's questions, then please reach out. What we found is that the information is, because we're familiar with it, we touch it all the time. It's a bit more, we're familiar with it. Without that, you you don't want to ignore it. You want to complete it. So if you have questions, just reach out. We can help to direct and guide you. The annual member magazine is something that comes out, and it will give you uh, best practices, tidbits, information that you can carry forward to use in your everyday life, whether it's recipes or exercise routines, things like that, and bettering your health. Next place, please. So the explanation of benefits is going to come out only when there's been services provided. If it's been 6 months since you've been to the doctor or had any prescription drugs filled, then there's nothing to explain, so you won't get an explanation of benefits. Also noted, you will get an explanation of each one of these documents, the medical and the pharmacy, as an individual. So you won't get that explanation of benefits in pharmacy for someone for any services that have not been provided or for any dependents or spouse. It's all per person and it only comes out when the benefits are incurred. About a 30 to 45 day lag time. So if I went to the doctor earlier this month in December, chances are I would not have the explanation of benefits yet, but I should get it within 30 to 45 days. Also, the explanation of benefits, while it can be mailed to you, you can also opt out of the hard uh, paper copy, and you can elect to have the electronic copy available to you through not only the website, but also you could have one mailed to you. Next page, please. So page 11 is the Medicare Part B is in boy and Part D for prescription drug medications. Part D is a longer list. It includes information for your shingles, your different vaccinations, hepatitis A, TB. Part B includes coverage for pneumonia, the flu, COVID-19. So just know you're covered either way. This just gives you a breakdown as to some are covered under Part B versus Part D. Next page, please. So here are a few key terms of the medical plan and how that's broken down. We're going to go over a brief overview. As I mentioned, the benefits at a glance will give you more detail, and the evidence of coverage will give you the maximum detail if you have questions. So we can just dive right in. Next page. The annual deductible is the amount that the member pays first before the insurance company will pay anything. So you have a $500 annual deductible, zero co-insurance, and a total of $1,500 out of pocket per person. On page 15, you have the overview, the costs and co-payments. You have a $30 office visit. That's if you go see your primary care physician. The same cost for a specialist. If you go see a chiropractor, it's only $20 per visit. The ER, emergency room visit, would be $100. Now that is waived if you are into the hospital within 3 days of going to the ER. So they may keep you sometime for observation or monitoring for 24 to 48 hours. If, as a result of that, they say, okay, we're going to admit you to address your challenges, then you wouldn't have to pay that $100 for the ER. The urgent care is $35 copay per month, and the ambulance is only $75 if medically necessary. Next. On page 16, you have your durable medical equipment. Here, as I mentioned, the services are provided through Northwood. You have a customer service number where you can engage them. Also, not only to get the canes, wheelchair, walkers, but also your diabetic equipment and things like glucose monitors and having those delivered to you. Next page. Prior authorization programs. These programs would be uh, necessary for different things like opioid, uh, well, if it's prescription drugs and different medical procedures might require a prior authorization. Your doctor, whoever is prescribing it, would be the one that works on your behalf as an advocate to obtain that prior authorization. You just essentially are being made aware that it is available and an option for you. But the doctor would be the one who would be reaching out and taking the necessary steps and action for it to be approved. Next page. So finding a provider. This is a PPO plan, preferred provider organization. So it was noted you don't have to get a referral like with an HMO or health maintenance organization. So there is no in and out of network. It's just considered and called a passive network. So your copays are just one amount, regardless of the doctor or hospital you go to. Next. On page 20. So how do you find a participating provider? So great question. You can do so by using phone, calling customer service, or navigating to the website listed there. Next, you could always ask or go online. On page 21 here, you have services for Teledoc, your online services. So many of you may have already used online services in your current plan. It's a way that you can, instead of going to a brick or mortar building and talking to someone face to face, you can go online and have a similar consultation where you can get feedback from the doctor or nurse. Now, this will be cases where you're maybe in a remote area, don't have access to the doctor, or say you're away hunting or on vacation. This wouldn't be for routine services necessarily. If you have those set up uh, for reoccurring video appointments, then that would fall under a different category. Next, page 22. So the mobile app we've talked about few times here. That is a way you can gain access to not only your ID card, details on your plan coverage, but you can navigate through explanation of benefits, track different costs. Also, you'll have the Blue Cross member portal where the .com is noted here. You can also get this similar information regarding your plan instead of getting the hard copies mailed to you or other information. Next. When you travel, you're covered. If you travel outside of the country, it's normally set up with emergency and urgent care worldwide. Your plan does for 2025 have an additional foreign um, benefit that's allowed that enhances it beyond what you would receive under normal provisional Medicare with your red, white, and blue card. So these foreign travel services are available to you. It was noted in previous meetings that if you are vacationing, say for instance on a cruise, then you may want to consider that additional insurance that they offer. It would cover things like being airlifted or an air ambulance, which is not typically covered under your foreign travel benefit. Next. So on page 25, so we've transitioned from discussion essentially about the medical coverage, and now we're going to focus on the pharmacy or prescription drug coverage. So you'll see here on page 25 that we're noting the robust network over 64,000 pharmacies nationwide. Included in that are more than 23,000 in the preferred pharmacies. Now, what's the difference? Preferred pharmacy are those that have contracted with Blue Cross and Blue Shield of Michigan to offer the prescription drugs at a lower cost to members than are offered by other pharmacies. So you'll notice most of your national name brand pharmacies are listed on page 25 here under the preferred network. Costco, Kroger, Meijer, Sam Club, all listed here. It is um, a living document, as is your formulary. Your formulary changes when new prescription drugs are approved by the FDA or the patent's in, and you get a brand name that's now covered under different generic prescriptions. So that formulary does change, as do at times the network pharmacies that are included. But these are the current list of those preferred, a partial list of the preferred network pharmacies. As I said, you'll never pay more than the standard network pharmacy or copay. On page 26, next page, it talks about the formulary, which is defined as the list of the drugs covered under your plan. It does change. The formulary today under your current plan is not 100% exact match of what it was in January or February earlier this year for the reasons I mentioned before. The out-of-pocket cost, CMS requires that there be 5 tiers to a Medicare Advantage plan. Those tiers are noted here as the labels that are given, the preferred generic drugs, all the way up to the specialty drug tier 5. The higher the number of the tier, the higher the cost of the prescription drugs, with tier 5 specialty drugs having a minimum retail cost of $800. Most are well above that, into the thousands of dollars. You don't pay the retail. You, for instance, only pay the maximum out-of-pocket cost. On page 26, you'll notice the middle of the page is $2,000. Now, this doesn't count towards the medical. Remember, the medical out-of-pocket maximum is $1,500. So this is a separate out-of-pocket maximum just referring to prescription drugs. And it's also administered on a per-person basis. So that means $2,000 out-of-pocket max for my prescription drugs, and if I'm married, $2,000 for my wife. They're not commingled or considered one bucket. Also, you'll never pay more than $35 for your insulin supplies. On page 27, this gets into the specific cost of your entire formulary or all your prescription drugs. You'll note tiers 1 through 5 under the preferred pharmacy network. You'll only pay $2 for tiers 1 and 2, $30 for tier 3 under the prescription drug pharmacy, the one more supply. Tier 4 would be $65. And then under the standard, you pay a bit more, about $5 more per prescription. So the 1 month supply, instead of being $2, $30, and $65, it's $7, $35, and $70. And then lastly, it talked about the 90-day supply, which is available to you at only a 2 times copay. So there is a discount to you. You don't have to pay the full 3 months. Next, on page 28, what do I use the drug list, or also known as the formulary, the list of the drugs? The list of the drugs included in the formulary. Well, this page 28 gives you a snippet or an excerpt of the formulary. So it'll show, for instance, From left to right, the drug name. It'll show what tier they're in, and then it'll show other things like PA for prior authorization or other limitations of things you should know. Next page, on page 29, utilization management. These clinical edits are in place. On page 29, these clinical edits. So prior authorization for the prescription drugs specifically, opioids may require a prior authorization. High cost drugs, the opioid epidemic lead to that. Different drugs that have a negative interaction if commingled. So if you have more than one doctor, if Doctor A is giving you one prescription and that is a drug that's known to have a negative interaction with others, then prior authorization for those other drugs might be required. Step therapy is the process when there's a generic or low cost drug available as compared to a higher cost, so maybe brand name drug. So step therapy may require you to start at the lower cost drug and then transition. Quantity limits are going to be instances where it's a high cost drug, or there may be cases where it's a high rate of spoilage or a low rate for which refrigeration might be required. In those cases, you might not be able to get a 90-day supply. They could limit it to a 30-day limit for prescription drugs, or even less than 30 days, maybe 2 weeks or 10 days. Next. So avoiding pharmacy disruptions. Even if the formulary as of 1/1/25 does not include the prescription drug that you currently are taking, you still would be able to get a one-time transition prescription fill as highlighted on page 30. I also would suggest that while we're in December of 2024, any prescription drugs that are available to you or that you have been taking, if you have access to 90-day supply of ordering that, then you could consider doing that for January. And then you would have 3 months, that 3 month supply, in addition to the transition prescription fill, which would be a 1 month supply, will give you 4 months. So even if the drug, one of the drugs you take is not included in the new formulary, you have a 4 month supply, which would allow you time to work with your doctor to obtain a alternative, or say a generic drug, or perhaps allow them to engage the appeal or exception process to get that drug added. Page 31, avoiding pharmacy disruption. So this elaborates more on that transition prescription fill that I talked about. It'll during the first 108 days, you can get that 1 month supply. So it clarifies 1 month supply for the prescription drug, even if it's not on the current formulary, and while there is an appeal process being pursued, perhaps to have it added. Next page, please. And on page 32, it talks about the notice of late enrollment penalty. So these are some documents coming out, letters you might receive that CMS requires and mandates, where you will have to take action by filling out the form. Just read it, try to follow the directions. I know that sometimes the information is not as clear and simple as we might want it to be. But nevertheless, if you have a question or concern, you're not certain, please reach out to the number that is listed as Brown and Brown, and they will work with you to get those questions answered, or you can reach out to Blue Cross. But any information, the late enrollment penalty, that will be invoked in two cases. One, if you did not have credible prescription drug coverage, which you all do, the current plan you have for prescription drugs is with Blue Cross Blue Shield of Michigan, all Blue Cross Blue Shield plans are credible. So you would not have a late enrollment penalty because of that, nor would you get a late enrollment penalty due to the break in coverage for 63 days because you will not have any gap in coverage. Your current plan goes through 12/31. The new plan starts 1/1. So that's not a 30-day period. Um, and so therefore you would not have that late enrollment penalty. But you will get the letters. You need to complete it and send it back because they won't take my word for it. Next, you have the coordination of benefits letter, same thing. Documents required by CMS are to be sent to you. You need to really just follow the directions and complete it. Send it back. If you have questions, concerns, it's not as clear and simple as you like, then just call Blue Cross or call Brown and Brown to get information. But the coordination of benefits, CMS will want to clarify or from you that you don't have any other coverages. So we talked about medical coverage. We talked about prescription drugs. Now, some of the additional health and wellness programs. Uh, I know we're all on camera, so I normally ask by show of hands how many people have heard of silver sneakers. Can anyone give me a hand raise? I can see a few of you. Okay, I did see someone. Thank you, Janet. So, Silver Sneakers, that is a program that is very well received. Those who heard about it have probably heard good things. Those who participate normally have positive feedback. It is not just a membership to thousands of gyms and health clubs across the United States. It's not only a online option for a person to receive best practices, access to online training, and so forth. But it also allows for the camaraderie of those who just want to go get good information. Uh, you can attend not just one fitness center or health plan within a day. You can go to two, three, or more. You can also, if you live in a rural area or you don't have access to a local health or fitness program, then you can plug in to all of the virtual online uh, programs that are available. We did look earlier. There were at least five different health and gym facilities in Midland that do participate. And so by 1/1/25, you'll be able to reach out through two silver sneakers to register. You have the 800 number and the days and times of operation here, where you can enroll. Once you get your ID card from them, silver sneakers, then that's your green light for being able to participate. They also have another benefit, not only for the health and wellness programs, but tuition reimbursement. So, a person who is in college or planning on going to college shortly, you can be an advocate for them, help them to receive additional tuition payments or reimbursement just by participating in Silver Sneakers and linking your account up with theirs or with their information. Next page. On page 36, it talks about Blue 365. This is a program you have today. It gives you discounts to different retail, local, and national brand companies, whether it's Evola Music or Great Wolf Lodge for local travel. You also have Dunham's, a national store, and others where you can get discount just by showing your Blue Cross and Blue Shield card, similar to what you would get like a discount for being a member of AAA. Next page includes Medicare Advantage rewards. So this is a great program where just by doing the right thing, you're getting paid. or you have incentives rather. So for things like preventative maintenance, you can have an incentive, maybe to get a gift card to this restaurant or that place. Uh, and again, they incentivize you, give you rewards for taking care of the things you need to the most, the preventative maintenance of ourselves. Next page, the coordinated Blue Cross coordinated care. This is applicable in situations where there may be chronic conditions, multiple chronic conditions you're faced with. You might have various prescription drugs, a half dozen or more you're working with, or it might not be medical or prescription drugs related. Maybe it's social uh, or other health specialists, behavioral health specialists you want to engage. Then you can, if you qualify, use this Blue Cross coordinated care. They'll help you and get you the information, direction that you need. Next page. These are some additional wellness programs that are available. I think I mentioned earlier the tobacco cessation program. So in the far right, the bullet point at the bottom. If you want that assistance, it is available. Again, free of charge, totally anonymous. There's also opportunity for non-emergency medical transportation if you qualify, and the meal delivery. It's noted that if you're going into the hospital, then certainly amongst your return home or release, they would offer and make available different meals that can be delivered to help make sure you're on the road to recovery, being able to stay at home and enjoy versus having a relapse and go back in. Next page. So Blue Cross and Blue Shield Engagement Center. So as we look to wrap up, and we'll take uh, in just a moment any questions that you might have, things that we've covered or haven't covered. This gives the phone number, contact day and time for the engagement center that can help you with coordinating programs, different referrals, things we talked about before. But this would be a point of contact for that. Next. Customer service, this is the 800 number that's listed here, the days and times of operation. So if you had questions about claims, you wanted to order a new ID number, or you have a change of address, something like that, this would be the place you want to go to. Go digital with Blue Cross on page 42. So you have a .com here. You can get access to electronic copy of your ID card, the explanation of benefits, where everything is tracked for you, all of your costs. You have all of this digital access to you, cut down on the amount of paper that you receive, or just being able to access it immediately. So you'll notice at the bottom, again, they're encouraging you to take advantage of the mobile app. You can have that information at your fingertips anytime, any place. So we appreciate you attending and participating in the online seminar. If you have a question, you want to either put it in the chat or we'll see if you can either raise your hand. Let us
Michael,
know.
there's a couple questions in the chat right now. Can you see the
Okay.
chat? I don't know if Angela can or not, but we can take
Yeah,
them one at a
we'll
time.
we'll navigate to it. Yep. Give me a second or two.
Oops. Hi, everybody. Can you hear me? Okay. So, awesome. Just a second. All right. So there were 3 questions here in this one. I will turn 65 next summer, so we'll sign up for Medicare in late spring. Do I sign up for Plan A and B, which equals C? Then also for the Part D Advantage plan through the county. So when you become Medicare eligible, let's say you become your birthday is May 15th. what happens is 3 months prior to your Medicare eligibility, you're going to get a letter from Social Security. If you have enough work credits, Part A will actually be free. There won't be any charge for that, and that'll be automatic. But you do need to sign up for Part B. And Part B, there is a premium for that. So everybody who is a retiree of the county today and is Medicare eligible due to age or disability has to have Part A and Part B. And then going forward, if you're going to become Medicare eligible, the same thing. Once you get that Medicare card after you've enrolled in Part A as in apple and B as in boy, you need to get a copy of that card to the county so that you can be moved forward to Medicare Advantage. So the May 15th birthday that I gave, the person actually would go into the Medicare Advantage plan as of May 1st, the first of the month that they became eligible for Medicare. All enrollees enrolled in the county's retiree health care coverage do need Part A as in apple, B as in boy, but you do not enroll or pay a premium for Part D as in dog. The plan does have a Part D benefit, but it's included in the Medicare Group Advantage plan, so you won't need to enroll in Part D. The Part B premium is typically taken out of one's Social Security check as a direct deduction from that. And for those who don't have enough work credits, Part A would also be out of that Social Security check. Another question came in, will the same card be used for dental and vision services? No. So everybody who will be enrolled in Medicare Advantage will be enrolled as an individual. Employee plus spouse separate, and those everybody will get their own Medicare Advantage card. The dental does not have a card. So you would just tell your providers if you're enrolling in dental that you have Delta Dental and they can look you up in the system. For those who have Blue Cross Blue Shield Vision or are enrolling in Blue Cross Vision, you will get a new ID card. You can use that. Your providers can also look you up in the system just by saying you have Blue Cross or VSP, and they can access your coverage.
Ange, can I just add on that a little bit on
Yes.
the dental and vision? So remember, dental and vision is a voluntary benefit that we offer retirees that are Medicare eligible to purchase. And because it's something that you're offered on optional basis, you have to re-enroll every year. So even if you enrolled last year, you still have to fill that paperwork out that was mailed to you. The deadline is this coming Monday. If you did not receive that and you want to fill out the information because you want to be enrolled in dental and vision coverage, then reach out to me and I will forward the packet of paperwork to you electronically. You are welcome to, fill it out and scan it in if you have the capability of doing that and email it back to me. Otherwise, the mail has not been overly predictable the last couple months as far as timing goes. So the sooner the better if you have not turned it in and you want to.
Thanks, Bridget. The next question is, our son is 49 years younger than me. He stays on our current Blue Cross Blue Shield, correct? That is correct. So if you're not yet Medicare eligible, whether you're a dependent, a spouse, or the retiree themselves, you would stay on your existing plan and you won't be receiving new cards or anything. And then my wife is 20 years younger than me and has her own health insurance through her employer. She will retire in 10 years. Will the county then cover her on Blue Cross Blue Shield? I think I need you to reach out directly to administration on that. Give them a call to verify per your union contract, per how you retired. Okay. I do see a hand up from S. Rice. If you want to unmute yourself, and if it's a generic question, not specific to a health condition or drug, we'd be happy to answer your question.
Great, thanks. I tried the chat and for some reason it locked up. So I have two that I think are generic questions. So
okay.
Are we understanding correctly that there's a $1,500 out of pocket for medical things?
Yes.
And then additionally, there's $2,000 out of pocket for prescriptions. So adding together, the out-of-pocket now is $3,500. Is that correct?
Yes, that would be the maximum, but I will tell you it's going to be pretty hard to hit that $1,500 for the medical because it's just going to be the co-pays that you pay for the various services. So $30, $20, the $100 on medical services. The other thing I want to know about the medical benefits is that it does state that there's a $500 deductible, but Blue Cross did make an error and they didn't have anything apply to that deductible. So for the year 2025, there truly is not a deductible. It's a zero deductible plan, but there should have been $500. In 2026, that will be updated and there will be a deductible that applies on certain things that don't have fixed copays. So things like hospitalization, surgery, durable medical equipment, those types of things. And then on the medications, yes. So the plans today do have an out-of-pocket maximum, but it's much greater than the combined 1,500 plus the 2,000 for drugs, or a total of 3,500. So again, those drugs, though, it's going to be a combination of what you pay in copays and sometimes what the plan pays itself. So coverage after meeting those maximum out of pockets, then will revert back to zero owed for you for the rest of the calendar year. So if you end up paying $1,500 in medical and or $2,000 in pharmacy, you'll continue to have those services, but you just won't have any cost associated with them.
Okay, and it does help. So related to that, though, it looked like this new plan is pushing towards generics. It's $30 a quote copay for those tier 3 drugs that are not generic. Is that correct?
That is correct. But what I will tell you about medications that are in the tier 3, 4, or 5 is most of those medications actually have alternatives that might be available at a tier 1 or a tier 2 copay. So I would definitely ask your doctor and pharmacist if there's a medication in the same therapeutic class that you could take that would be a lesser cost. So at standard pharmacies, the copays are $7, $35, or $70. At preferred pharmacies, that's going to be $2, $30, and $65.
Okay, and at the risk of hogging here, but I still think it's a general question, there was mention of having to fill out the coordination of benefits survey and that sort of thing. Does that have to be completed and returned before January 1st?
No, you most likely will get it after January 1st, along with that Part D letter that they mentioned. You do need to return those, though, because if you do not return the coordination of benefit form, they're going to stop paying claims. So they're trying to verify, and they need to verify that you don't have other coverage. So please return it, even if you don't have other coverage. If you have any questions, you're always welcome to call our offices at Brown and Brown to help you with that. And then that letter, that Part D letter that you're going to get, again, you need to fill that out stating that you did have credible coverage before, so you're not charged a penalty. And again, if you have questions about those are going to come out the start of the year, sometime January and February, most likely. That coordination letter could happen anytime during the year. Make sure you're returning those. And again, if you have questions, reach out to us. All right, Rocky, I see that you have a question.
Yeah, it's actually on me. Can you hear me?
Yes, I can.
Hi, I'm Rocky's wife, and the question that I have is related to someone else's question. I don't turn 65 until April, but yet I did get the Medicare Advantage information packet. But I also recently received a notice to request information from Blue Cross Blue Shield asking for my Medicare number, which of course I won't have for a while.
You don't have yet. So, Liz or Melissa, can you write this down? Because I don't have a pen. What is your name, Rocky's wife?
I always go by Rocky's wife. No one ever knew my name.
What's your name?
That's wrong. That is just wrong.
It is so wrong.
That's not true.
Okay, my name is Jill Graham. Hello, everybody.
Jill Graham.
Now you know my name.
All right, we'll research that, and then you have our telephone number, because I don't want you to have to put your telephone number in the chat or tell us over this call. But I want you to call our office, ask for Melissa. The number is 866-421-0478, and then we will get back to you on that. So we did submit some members' information ahead of time, even through April 1st, I believe, because Blue Cross wanted to know who was coming into the plan. So that's probably why, but we'll confirm that, okay?
Okay, because that was my biggest concern, because it
Yeah.
says to apply
Yeah,
by
you can't
December
be
31st.
enrolled and you won't be enrolled until your actual enrollment or effective date would be April 1st of 2025.
And just a follow-up on that. So
Mhm.
if Jill and Rocky had, like, they don't need to currently enroll separately for dental and vision because they still have it because she's not Medicare eligible, right, through the PPO. When she is enrolled in Medicare Advantage, they'll have an opportunity at that time to extend and openly enroll in the voluntary optional dental and vision, correct?
Yes, that is correct. Yeah.
Okay, and I've already sent them those forms. I did have another question that came in by email to me, and that is, someone didn't get an enrollment packet, but Blue Cross didn't send enrollment packets out because we're automatically moving everybody, or
Yeah, they
we're
send
just
out kits, not enrollment packets.
okay.
So if you want to share the member's name, what I've been doing is checking the census to verify that they're on the census.
Mm-hmm.
And then if a household of two, if at least one of them got the kit, they're okay. But if both didn't get the kit, we need to know so that I can get them a kit. So I see the name
Okay.
in the chat. Melissa, do you see that? Will you grab that name? Perfect.
Yeah,
Anyone
I
else
put
have
it
any
okay.
questions? Yes, Janet. You can unmute yourself. You'll have to hit there's a microphone that'll have a red line through it. There you go.
This is for Bridget.
Yes.
I sent the vision and dental forms in the mail yesterday.
Okay.
Do you go by postmark or do you go by receipt?
We'll figure
It'll
it
be
out.
okay.
It'll be okay. We'll figure
You'll
it
get
out.
added.
For
be
us
okay?
really, Janet, for us really, it's a matter of making sure that we have time because it's something that is paid for out of your pension check, that we can
Right.
get you enrolled and then make sure that the premium cost for every month is included as a deduction in your pension
Right.
check. So,
I've had it
we
for
should
the
be
last
fine.
year.
Yeah.
Okay, great.
Even
Yeah.
if we receive it end of January, we can still retro enroll it. So it's not a worry.
Okay.
That is
Process
not
in the mail.
permission for everybody to send their
No,
stuff in late.
no,
I'm just
no.
telling you.
Don't.
Okay.
Yeah.
Thank you.
Hops. All right. Anyone else have a question?
Paula.
Yeah, Paula. Unmute yourself the same way, please. There'll be a little microphone with a red line. Thank you.
My question is, my husband is diabetic, and I noticed in one of the little blurbs as we were going through that for diabetic supplies and stuff, it listed somebody other than we've used in the past. I think
Yeah, so the durable medical equipment is done through Northwoods, but there's also a program that Blue Cross Blue Shield has through Teladoc for diabetes management. And if you enroll in that program, Livongo, or it's Teladoc powered by Livongo, as of after 1/1, that program actually provides a free glucometer, free test strips and lancets. So I would suggest that, but prior to any enrollment in that, durable medical supplies should be received through Northwoods, and there should be information in the pre-enrollment kit. If not, reach out to our office and we can get you that contact information, or you can just tell your providers who are prescribing those to send that through Northwoods. They should know already because that's the preferred provider for Blue Cross Medicare Advantage. Great question.
Yeah, I think we use US Med, so we'll have to do some switching.
Okay. Ben and Linda, I see the hand up. And then Glennie, I did see your hand up. I'll ask you in a second.
Easy question. How do we access the drug formulary?
Yeah, so if you go to Blue Cross's website, and actually, I may be able to copy the link. Give me a second. Can you see the chat?
I'm not sure.
Okay. I will tell you if you call our office. We can email it to you.
Okay.
We can also, I think I've got it here. I'm going to copy the link, and I'm going to paste it into the chat. But it is the Blue Cross Blue Shield. Okay, why isn't it letting me? Oh, here I can type something, I think. We can email it to you, but it's the yeah, I'm gonna have Melissa put it in the chat. I, for some reason, can't right now. Let me
I'm
actually,
sorry. I'll just interrupt for just a second. I found that I couldn't type in anything either, and I wonder if maybe it got locked at some point
okay.
when this first came up.
Yeah, I did. I was able to put it under Bridget's most recent response.
It actually does say that all participants can put into the chat.
Yeah.
So I'm not sure when I look under host tools, you should be able to. So I'm not sure.
Okay. It looks like Melissa was able to do it as well too. But I did include it under, and Bridget, was that a direct message? Oh, so no one else can see it. Let me reply under a non-direct
Oh, let me
message.
do it. Let me do it.
Okay, you can copy and paste it. So if you go to Blue Cross's website, it's bcbsm.com.
Nope,
And if
it
you,
won't let me copy and paste. That's very weird.
okay, I'll let me reply under one of these other ones because
This is the right audience. You all remember the Gremlin movie. That's what we have right now. Gremlins.
Yeah, so okay, I just put it under someone else's. But if you go to bcbsm.com, you're going to be looking for Medicare formularies, and
That
then it is
wasn't
going to be
okay.
the
Yeah, gotcha.
custom enhanced formulary. It is the largest formulary that Blue Cross has. Once you've opened, Melissa was able to put it too, so you can click on that link. But Melissa, I'm sorry, once you open that formulary, it's going to be in a PDF format. The easiest way to search for your medication is to do a Control F, and then you can type in the little space bar what that medication is, and it will tell you if it's listed, what tier it would be, and then you can compare the tiers to what you receive for your benefit at a glance. All right, and then Glenn, you had a question?
Yes, we do have questions, lots of them, actually.
Okay.
I'm Glenn's wife, Yvonne, and we did not get anything but the Medicare benefits at a glance. So even though you guys were going through all of everything,
Did you get those from Blue Cross Blue Shield, or did you get them from Midland County?
from the Midland County, yes.
Okay.
I think I have them on the way, okay, but that's after this meeting, okay?
Okay.
We'll get a bigger packet later, but we don't see exactly what you're doing, okay?
Okay,
So-
the PowerPoint that we shared was not shared with everybody, but there was a kit that was mailed to members home from Blue Cross Blue Shield. So
they need a kit, Angela.
yeah, we'll write down your name. It's Glenn, Alvoord. And we'll work with Blue Cross Blue Shield to get you kits. And
Okay.
Gail is your name?
My name's Yvonne.
Yvonne. Okay, Yvonne and Glenn. Okay, thank you. What's your next question?
Okay, my question was that do we enroll in this every year? Are we doing the enrolling for dental,
Nope.
for the vision, for this Advantage plan?
So
No?
for the medical plan, that's automatic. But
Okay.
dental and vision going forward, once you become age 65, if you do want that coverage, you do need to enroll in that annually. Otherwise, you will be dropped from coverage. And
Okay.
annually, because it's a voluntary program and the rates can change, that's why you'll get that notice that tells you how much it is for dental, how much it is for vision, and then you can decide what you want by returning the forms.
Okay, all right. So there's going to be some correspondence. When we get letters, we're supposed to correspond back as soon as possible.
Yeah.
And go from there.
Yeah. Okay,
right.
and it does look like your packet was actually mailed to your Florida address, by the
Okay.
way.
Yes.
So
Yeah.
it may be waiting for you, but have
So-
you given Farron your your other address? Okay, fair, thanks. So
Yeah,
we'll make sure we get
we're
that
gonna have to
checked.
figure this out because of that reason, just stick with
Yes.
one address and then.
Yeah, you'll need to switch if you're going to move back and forth. If you have multiple addresses, you need to make sure the county is aware of your address at the time, wherever it is. So if it's twice a year you're moving, make sure the county has the new address so that they can make sure Blue Cross is updated so you're getting all the notices.
It's
Okay.
really, really, really important around, the year end. And I know that's the time
Yeah.
that, a lot of retirees want to leave Michigan because they don't love the cold weather.
Who
But
knows?
that's probably the most critical time for us to make sure we have your accurate information because we're sending so many things out to you.
I get it, sure.
Did you
Okay,
have other questions?
well, probably do, but not at this time.
Okay,
Not-
well, in our number, again, the 866 number, you're welcome to call it. Does anyone else have any other questions?
Just
Yes. Go ahead,
just
Jane.
one more at the beginning, you indicated that this was being recorded.
Yes.
So are we able to access this recording?
I'm going to put it on a link somewhere and try and make it available to everybody. As long as you gave Brenda your email, which you would have had to for receiving the link today, then we can send that out to you.
All right, thank you.
Great, thank you.
And there could be 2 links, Jill, because we'll record the second meeting also, just in case there are different questions that get asked.
Yeah, that'd be great. Yeah.
Anybody else? And if you can't raise your hand or otherwise, you can always unmute yourself by the little microphone with the red line through it. Did I hear anybody? All right. Well, we appreciate you tuning in today. Thank you very much. And
Hello.
Oh, I'm sorry. Yes, go ahead. I didn't hear you.
Okay, just one question. This is Tammy Gillis. I'm just wondering right now, how do you know a preferred or a standard pharmacy?
So I'm sorry. So it's going to be the ones that primarily were listed on Michael's sheet, but also if you go to Blue Cross's website and you're searching for Medicare Advantage plans, there is a link that allows you to search for pharmacies near you. And when you're searching for the pharmacies near you that are in network, it will tell you whether or not they're preferred. So if they're preferred, they will be marked that way. Like CVS is not a preferred pharmacy, I don't believe, but Walgreens is. So you can search and it will tell you preferred or not preferred. And then you'd also know if you were actually at the pharmacy, whether or not they were charging you the $735.70 or the $230.65.
Okay, well, I live in the UP, so there's limited pharmacies up here.
Okay. Yeah. So you can search for providers, or I'm sorry, pharmacy providers by your zip code, by your city and state as well too.
Tammy, you
Okay,
also
thank
want to, Tammy, you also might want to consider the mail-in. I mean, there's several different pieces of information that were in the presentation as far as the mail-in options go. And the copays will actually be only 2 months worth for 3 months worth of medication.
Okay, thank you, Bridget. I know also that I do use the mail pharmacy up here for a couple of my scripts, but I'm having surgery next month. So this is really a lot of questions that I'm trying to take in.
Yeah, totally understand.
Thank you.
Okay, I think I just figured it out. I was able to put in the entire meeting group chat the pharmacy locator. So you can click on that link to search specifically by city, state, zip code. If you click on that link now, it'll be open when this is closed. Perfect. Anybody else have any other questions? All right. Thank you very much, everybody. I hope you have a wonderful holiday season and reach out to us if you need assistance.
Bye.
Thank you.